Hi everyone, my name is Olivia Mancini and I've created this presentation alongside Marcy McKelveen and Dr. Timothy O'Shea. Our presentation is called I Support My Neighbors in Tents, a human rights-based strategy to encampments and unsheltered homelessness. So our learning objective for today is to develop a human rights-based strategy and effective solutions to growing encampments and unsheltered homelessness across North American cities, and to ensure that residents of encampments and other people deprived of housing are given a meaningful role in the development of programs and services in a manner that recognizes their knowledge and expertise. Our presentation outline, so we will briefly discuss the increase of encampments and COVID-19. We'll also talk about the National Protocol for Homeless Encampments in Canada, and we will discuss the responses to encampments in the city of Hamilton, as well as the qualitative study of houseless encampment residents' experiences during the COVID-19 pandemic. So we'll go over the methods, results, recommendations, and discussion. So the COVID-19 pandemic has led to an increase in the number of homeless encampments in many North American cities. Policymakers have instituted a wide range of measures in response. Most have been focused on limiting where and for how long individuals are able to congregate. Little is known about factors which lead people to seek shelter in an encampment and those which encourage people to leave encampments. The UN Special Rapporteur on the Right to Housing advised municipal governments to take a human rights-based approach to encampments, as housing is a fundamental human right. So the National Protocol for Homeless Encampments in Canada included the meaningful engagement and involvement of residents of encampments in the decision-making process to access safe indoor spaces, as well as immediately and dismantling and displacement of residents of encampments. So the response to encampments in the city of Hamilton has included the municipal government has been focusing on framing residents of encampments in a negative light and using coercive measures to dismantle encampments and displace residents. In July of 2020, community organizations joined with encampment residents to successfully seek an injunction against moving people from encampments. A settlement was reached, resulting in an encampment protocol, which provided a 14-day grace period before moving encampments, and a provision that people would not be moved without alternative accommodations put in place. In August of 2021, the City of Hamilton unilaterally revoked the encampment protocol and returned to pre-pandemic enforcement of bylaws. So this means that bylaw officers could go to encampments and dismantle them and move people along without providing alternative accommodations for them. So the qualitative study of houseless encampment residents experience. The qualitative study took place in September 2020 in 2 encampments in Hamilton, Ontario. Participants were recruited by peer support workers who were conducting outreach within the encampments and referred to the study team for consent. There were 20 participants who were interviewed, 6 identified as female, 13 identified as male, and 1 preferred not to provide gender. The average age of interviewed participants was 31 years old. The interview guide was developed by 2 members of the research team with input from peer support outreach workers who were active in the encampments. Questions were framed in a way that information could be used in planning and development phases of a pragmatic response to the issue of growing encampments. So 3 main themes were identified in the results. So the first theme was judgment, stigma, and strict rules as barriers to accessing shelter. The second theme was the importance of community. And the third theme was the importance of housing stability. So of these, the first was identified as a factor in leading participants to seek shelter in an encampment. The second as influencing residents to remain in the encampment, and the latter was identified as important in participants' decision-making around leaving the encampment. So several participants had identified previous negative interactions at emergency shelters as a key factor in their decision to seek shelter in an encampment. Unfair application of rules and shelter restrictions were a common theme. So one of the encampment residents stated it was like being in jail. They check your room every hour. If you're in the bathroom, then they make you come out of the bathroom just to make sure you're all right. Not allowed to have other people over, not allowed to visit anyone, and you're not even supposed to talk to anyone. So in this example here, this was in one of the hotel programs. So they are checked on every hour and they're not allowed to have any visitors in their room. So this kind of contributed to the invasion of privacy, which is mentioned in the next comment. So another resident had stated, it's just that the rules and the invasion of privacy and just that they'd split me up from my partner. And it's really traumatic for me, actually. It brings a lot of my childhood memories back, so it would do more harm for me than good. So the shelter system in Hamilton, there isn't shelter for couples without children. There is a temporary hotel program that is taking couples right now, but typically there is no shelter for couples without children. So a lot of people will choose to stay outdoors so that they can remain together. So the importance of community, this theme was identified both as it related to individuals' decisions to reside in the current encampment and when considering future housing options. Interview subjects reflected on the value of working together with friends and other encampment members. So one encampment resident stated, good being the community support, friendships. If you need something, you can ask your neighbor. If that neighbor doesn't have it, you can ask the other neighbor. And another resident stated, I hope they can get us maybe shared accommodations. Instead of giving us single dwellings, maybe they can get a bunch of us put together into a bigger home and let us share a home or something like that. So this person was referring to having supportive housing where they have the option to live together in a communal setting. And the importance of stability in housing. So interview participants had outlined the importance of being able to remain in one location, close to services, as an important benefit of living in an encampment. Conversely, several participants commented on the destabilizing effects of being frequently moved, either within the shelter system or from areas where they had previously been sleeping rough. So one encampment resident stated, ideally, I would like to be in a house again, but somewhere permanent that we can stay is more efficient than being moved around. Another encampment resident stated, but I don't think they understand how shutting this down is not going to make anything better. It's going to make things worse because we're going to have nowhere to go again. We're all going to be all the progress we've made will be gone, pretty much because they're not going to be able to find us anywhere. We'll be sleeping in ATMs and stairwells and things like that, right? It's really not, we're spread out more, but it's not better. So this encampment resident was referring to different outreach workers and doctors not being able to find them because they keep being displaced from one encampment to another. So they're constantly moving across the city. So it's difficult to maintain those relationships when they're not able to stay in one location. So some recommendations that came about based on encampment residents' comments throughout the study. So first, how to address strict rules, stigma, and judgment in the shelter system. So we believe a comprehensive review of the emergency shelter system is required. A new approach to issues such as early curfew, lack of space for couples and gender diverse individuals, punitive service restrictions, and an overall lack of harm reduction approaches are required with the overall goal of making shelter more accessible. And how to address the importance of community. So respecting the desire for autonomy and contributing to the formation of community norms and mutual expectations, and providing meaningful role in the development of programs and services in a manner that recognizes residents of encampments' knowledge and expertise. So I think it's really important for encampment residents to be included in the decision-making process to relocate. Oftentimes their opinion is not being considered in the process of dismantling encampments, which I think is really important. And so another recommendation is a greater investment in low barrier permanent supportive housing programs. So there is a need for ongoing support, connection, and community once housed. Housing allowances and housing first workers are not enough to help people successfully maintain their housing. Recommendations for permanent supportive housing would include having supports on site, harm reduction, peer support, and community. So what would supports on site look like? So having mental health services. So for example, a mental health practitioner could come in once a week to meet with residents to provide mental health support. And then recreational programs. So this could include yoga, going on hikes, having a community garden or a paint night, and just having space within the housing to participate in recreational activities. So maybe some gym equipment and things like that. Indigenous specific cultural support. So having traditional healing, cultural ceremonies, workshops promoting cultural arts and ways of knowing and being. And the other one is harm reduction support. So for harm reduction, we think it would be important to have a safe space to use drugs on site. Partnership with healthcare providers to access a safe supply of drugs. So the goal of safe supply is to provide people who use substances access to regulated substances from a legal source to reduce some of the harms that are caused by the toxic drug supply. And this would decrease overdose-related deaths, which would ultimately save lives. Also, overdose prevention and education. So this could include how to use substances more safely, learning safe injection practices, providing naloxone training, teaching people how to recognize an overdose and how to respond to that overdose, and learning about the Good Samaritan Act and what that means, and as well as providing harm reduction supplies. So harm reduction is an evidence-based, person-centered approach that seeks to reduce the social and physical harms associated with substance use. And the philosophy and main features of harm reduction include pragmatism. So harm reduction understands that people will be using substances and that it's essential to use a public health strategy to reduce those potential harms. There's also humane values. So people who use substances are treated with dignity and respect, meeting people where they're at without judgment, and individual choices considered when minimizing these harms. And also a focus on harms. So an individual's substance use is secondary to the potential harms that may result in that use. So peer support workers who have lived experience of homelessness, mental health, and substance use to provide support to tenants. This could include facilitating groups, helping tenants with activities of daily living, and peer-based harm reduction supports. So again, with the peer model, they could do naloxone training and even develop substance use safety plans with some of the tenants in the housing. And for community, so allowing tenants to create their own care and support plan to maintain their housing in collaboration with housing support workers, allowing tenants to develop mutual expectations and shared responsibilities in collaboration with each other to develop a sense of community, allowing tenants to host and plan programs on site and community events. So this can include like a movie night, cooking class, having writing groups or art-based activities, and having a communal space to share meals and spend time together. So the study provided insights into encampment residents' perspectives on factors which may be influencing the current increase in encampments in North American cities. The results of this study suggest that to decrease the need for encampments, policymakers could focus on improving the emergency shelter system, recognizing the importance of community, and ultimately providing an increased supply of affordable, accessible, and permanent supportive housing. Those are some of our references there, and then we'll have time for discussion questions. So thank you. I hope you enjoyed our presentation.